What does high ALT mean for your liver health? Imagine your liver as a busy factory working tirelessly to keep your body running smoothly. When everything is working well, the enzymes inside liver cells stay contained. But if the factory gets damaged or inflamed, some of those enzymes, especially one called alanine aminotransferase or ALT, can leak into your bloodstream. That's why high ALT levels in a blood test often point to liver cell injury or damage. ALT is an enzyme that helps break down proteins and is mostly found inside healthy liver cells. When liver cells are injured or dying, ALT escapes into the blood, causing the levels to rise. This makes ALT a sensitive marker for liver injury, meaning it can detect problems even when symptoms aren't obvious. However, a high ALT doesn't tell you exactly what caused the damage or how severe it is. It simply indicates that something is affecting your liver cells. Common reasons for elevated ALT include viral hepatitis, which is caused by infections like hepatitis B or C. These viruses cause inflammation and damage to liver cells. Non-alcoholic fatty liver disease, often linked to obesity and metabolic issues, can also raise ALT levels, especially if it progresses to non-alcoholic steatohepatitis, a more severe form. Drinking alcohol excessively can harm the liver and lead to higher ALT. Certain medications or toxins can also cause liver injury, as can liver conditions like cirrhosis or liver cancer. Less frequently, inherited conditions such as Wilson's disease or alpha-1 antitrypsin deficiency may be involved. It's important to understand that the level of ALT elevation doesn't always match the extent of liver damage. For example, very high ALT levels, above 1,000 units per liter, often suggest acute severe injury, like from viral hepatitis or sudden blood flow issues. On the other hand, mild to moderate increases might be seen in chronic liver diseases or even in non-liver conditions like muscle injury or heart failure. ALT levels can fluctuate over time, especially in chronic hepatitis C, and a normal ALT doesn't necessarily mean your liver is healthy. Some people with advanced liver damage may still have normal ALT levels. From a liver cancer perspective, persistent high ALT can be a sign of ongoing inflammation or injury. Chronic inflammation is a known risk factor for developing liver cancer, especially in people with hepatitis B or C or cirrhosis. Monitoring ALT along with other liver tests helps doctors evaluate liver health and the risk of cancer development. If your ALT is high, your healthcare provider will likely recommend repeating the test to see if levels are changing. They may also check for viral hepatitis, review any medications you're taking, and assess your alcohol use and metabolic health. Additional tests like liver function tests or imaging scans might be needed to look at your liver's structure and degree of scarring. Sometimes, a specialist in liver diseases will be involved to help determine the cause and develop a treatment plan. Lifestyle changes such as reducing alcohol intake, managing weight, and controlling metabolic risk factors can help lower ALT levels and support liver health. Treating the underlying cause of liver injury is key to preventing further damage and reducing the risk of complications, including liver cancer. Remember, a high ALT is a signal that your liver needs attention, but it's just one piece of the puzzle. Always consult your healthcare provider for personalized advice and a comprehensive evaluation to keep your liver healthy and functioning well.